So nurses and physician assistants at Ankaful Psychiatric Hospital have begun a sit-down strike to demand the immediate removal of Dr. Dordoye as medical director. The nurses have leveled allegations of human rights abuse, conflict of interest and misappropriation of funds against him. In a letter to the Chief Executive Officer of the Mental Health Authority, the health workers indicated that several attempts against the Ministry of Health to dismiss Mr. Dordoye has proved futile. The striking health workers say they will return to work as soon as Dr. Dordoye is removed from the hospital. The letter to the CEO of the Mental Health Authority reads, and I have it with me here, please take notice that we, the nurses and physician assistants at the Ankaful Psychiatric Hospital, wish to remove ourselves from the danger posed to our mental and physical health by the illegal, oppressive, traumatic, degrading, abusive, embarrassing, and general egocentric behavior of the hospital director, Dr. Dordoye, with immediate effect. The specific actions complained of are those contained in A, our petition to the Honorable Minister for Health, dated 20th October 2017, copy attached. B, the report submitted by the fact-finding committee that investigated the goings-on at the Ankaful Hospital, dated 23rd to 26th October 2017, copy attached. And C, the subsequent actions of Dr. Dordoye from October 2017 to date, including while the mediation efforts aimed at addressing the complaints were ongoing. For the avoidance of doubt, we hereby state clearly that we are not on strike. We are taking this action under Section 119 of the Labour Act 2003, Act 651, and accordingly, we are ready to return to work as soon as he is removed from the hospital. For the avoidance of doubts also, we are not asking or insisting that he should be dismissed or that his appointment should be terminated. What we are asking for is that he should be removed from the Ankaful Psychiatric Hospital and be given the requisite training on people management and effective leadership, as has been suggested by the fact-finding committee, before coming back to run the hospital, in order to save us from the physical, emotional, and mental torture he has been subjecting to us to, as well as to give us a fresh atmosphere to enable us heal our emotional and psychological wounds, as same as being hindered by his continuous presence. Please take notice. Yours faithfully, Daniel Dansu Sapon, local chairman, PNG, and Malcolm Akatenga All. He's a local secretary for PNG. Richard Kojonyako is at Ankaful for Joy News, and he joins us via phone. Richard, let's refresh our memory on how all of this started.
Well, some weeks past, these nurses at the Ankaful Psychiatric Hospital embarked on a sit-down strike, and it was one of the series of actions they said they were taking to get Dr. Dordoye out. And Dr. Dordoye is the medical director of that facility. So they started with the withdrawal of their services. And when we went to the Ankaful Psychiatric Hospital, a lot of relatives brought their people, their mentally challenged persons, others that came to also get some medication. They were not all catered for. And so it forced the Mental Health Authority another series of meetings in Accra to get these nurses to back down their actions. It appears that they succeeded, and so they decided to hold a series of meetings and to sign some memorandum of understanding to ensure that the medical director and the nurses coexist peacefully. But it appears that things are breaking down. This morning, the nurses are at the Ankaful Psychiatric Hospital, but they are not giving the patient any attention. They are not working, so to speak, even though they are present at the facility, unlike the previous times where they refused to even come to the facility. But today, they are there, and they are saying that until Dr. Dordoye is removed from the hospital, they are not going to give medication to the patient and the others. They say they are suffering from psychological and emotional trauma being visited on them by the medical director, and as mental health workers, they cannot work under such harsh conditions.
Okay, Richard.
Yeah.
Is Dr. Dordoye around?
Yes, Dr. Dordoye around. I spoke to him about 2 days ago when they had not started this action. But this morning, I've been trying relentlessly to get to him. I've been calling his line, but he's not gotten back to me. But he is in the facility.
Okay, so how are the patients reacting? We have nurses there who are not working. What are the patients doing?
Well, they just started the action this morning, and so we are yet to feel the impact of what they would be going through or what the situation is right now. Right now, the patient and their relatives are at the premises of the OPD, and the nurses are there, but they are not really attending to them.
We'll come back to you, Richard, when there's more to report. Thank you very much. Richard Kojonyako is our man in the Central Region.